Just while our next speaker is coming to the podium, Nuno, never apologise for no PowerPoint, my kind of person. But just the three takeaways I had from what Nuno just presented. First of all, the obvious approach which they have taken in Portugal, which is to decriminalise and move to an administrative approach in terms of penalties. Secondly, the political consensus that Nuno described was worked up before change in legislation. And thirdly, the structures around, or the coordination around a health-led approach. I think that's important because many countries have moved to health-led, but I think they have stepped up their coordination around it. I think is the message I took away. So now if I can just welcome Alfred Uhl. Alfred's travelled from Vienna, the Public Health Institute in Vienna, and going to describe some of the experiences of Vienna, Austria, I should say, in terms of approach. Thank you.
All right. So I want to start with my personal background. I started 47 years ago to work in research for the health ministry in Austria, and so my perspective is to look at the development, basically what happened since I started there. My background is epidemiology, advising prevention and coordinating basically treatment facilities. The situation in Austria is very specific, and what you see here is when the whole thing started in 1956. Some psychiatrists from University Clinic decided that addiction, in this time alcoholism, is an issue. And it was fortunate that very important psychiatrists started, because due to this, addiction treatment turned into something like diabetes or whatever. If you have a problem, you are treated. So from the beginning, there was always sufficient treatment facilities available for people. It was not something on the edge where you have one program somewhere or one unit somewhere, but it was mainstream treatment like anything else. Of course, psychiatrists at this time were very conservative, so basically their direction was towards abstinence only. Gods in white, as doctors at this time were called. But the founding was very interesting because the founding board consisted of federal ministries, state administrators, health insurance, labor union, Catholic, welfare organizations. So all parts of society were involved, and this is a way that in Austria many things happen. They are private in a way, but government determined. I mean, it's representatives from government and institutions. And there was a research obligation, Boltzmann Institute for Addiction Research, where I started to work, was part of the thing, and they still have to do. They have to do it. And another thing is to do research. And another important thing is everything is covered by the federal regulated health insurance system. If you hear insurance system, it sounds like something which is private, but it's government organized, mandatory to be part of it, automatic. So if you have low income, you pay like 50 euro. If you have high income, you pay very much. And if you are not within the system, then the government pays for it. So practically everybody is covered with it, except for foreigners who have no rights in Austria at all, but refugees have it. So basically everybody is covered by the system, regardless if he worked or what problems they have, which is a very important thing to know. Then a department for female alcoholics started, strictly inpatient, abstinence-oriented. Inpatient beds were created as needed, outpatient treatment primarily for admission and follow-up. So there was no independent, or hardly any independent outpatient treatment. They were only used to get people to the clinics and to support them afterwards. But regional counseling centers evolved in every region, every federal state, which was quite an interesting thing, publicly funded. So this coordination that we heard about in Portugal started right from the beginning. Then suddenly drugs, illicit drugs became an issue, and 1972 the first inpatient drug clinic was founded, residential treatment for 1 year. In the alcohol field it was for 6 through 8 weeks. Regional counseling centers evolved so that more and more different centers, private initiatives started. In 1971, a new narcotic act said treatment instead of punishing, and so this was a very important change, but everything went stepwise. So first, there was just the idea that everybody should be treated, but the absurdities. I went to Parliament when they had incredibly low amounts, so half the dose of a heroin user was considered crime against public health, and if you had a crime against public health, nothing could get you into treatment. Yeah, and stepwise things improved. Treatment instead of punishment evolved over time, and finally, presently, if you commit a burglary or a robbery and you are sentenced less than 1 year, you can already your sentence can be postponed if you go to treatment. And if you go to treatment, it can be cancelled afterwards, so you are not punished even for crimes to get your drugs. Shortly, when opioid substitution started, there were experts saying that 2/3 were against substitution treatment, and there was a very strong discussion, and after this discussion, 2/3 were in favor of substitution treatment, and in the beginning it was only for very bad cases without any chances, and more it turned into mainstream. Now we have a problem, of course. Many people in the substitution treatment are old and retire, and we need institutions like retirement homes, private service for people who are substituted, who cannot go to a pharmacy regularly. So there's problems coming up, but the system is integrated and works quite well. I did several Delphi studies involving all important experts from treatment, research, policy, and the positive thing is that everybody important was involved. So basically, whenever somebody complains, you can always see, well, you were in it, and we had 90% support. So basically, there's not very much opposition in Austria going on. And the last Delphi study I did was the basis for a national prevention strategy, which is an overall strategy which has been accepted by the government by now with some really basic concepts. Harm reduction became mainstream. The idea is as little harm for people involved and for people around them. But we have no injection room and heroin treatment, probably because United Nations is in Vienna and they were very much opposed to it. Very important is to cooperate with police, of course, because if you have street work drop-in centers, acceptance-oriented treatment, it does not really help if the police collects everybody in front of the place. So you need a good cooperation.
Just 2 minutes, Alfred, please.
Yeah. So you need a good cooperation with the police and with all different segments, otherwise they make several attempts impossible. One problem is that whenever somebody is called for an overdose, there's always the police called as well, which prevents people from calling the police and increases, of course, the number of overdose deaths. And now, this is, I think, the last slide. We have one addiction coordinator in every federal state with funding power. So the places, treatment facilities and prevention centers are private, but if the government controls the payments and controls what they are supposed to do, it's practically not private. A federal drug commission includes all addiction coordinators, Ministry of Justice, police in this board, and a few scientists, so I'm in this board as well, and they decide on laws and strategies prepared for the Minister of Justice and for the Minister of Health. There's we have, of course, a central institution now in every federal state coordinating things. And in Vienna, they introduced an integrated service where a central body decides who goes to which institution. Unfortunately, this is not so easy in states where there's large distances, but they decide where to go to. We have liaison services, divergent approaches, more and more outpatient treatment. Stepped care is in a way that small problems are dealt with small interventions, and if you have big problems, then you have long inpatient treatment. And integrating social work, housing first, finding part-time jobs for addicts and former addicts. So the whole thing is working quite well, and the most positive thing to say is it was always considered a health issue, and so up till now, there was always sufficient money to fund everything that has to be done, and everybody has access because of our health insurance system.
Thank you, Alfred. Thank you very much. Thank you, Alfred. And again, another example of a health-led approach in a more integrated way, probably a more mature way than we probably have in this island and this state, and mainstreaming harm reduction. I think it's a very important term, but a lot of good examples behind it. Okay, conscious it's warm in the room today. Everybody feel warm? Can I just ask you now for the next 5 minutes, we're okay time-wise, next 5 minutes around your table with your facilitators to just pose some questions that you'd like to pose with the panel. We'll allow good time for you to pose some questions to the panel. When I do come to it, I'll take 2 or 3 questions together, just as we did the last time, to try to get through as many as we possibly can. Thank you.